Hi all. Today we are going to discuss about dysphagia and stroke. This is the second session. We have discussed already about dysphagia and stroke in the first session. That's a normal swallowing process. Dysphagia means difficulty in swallowing. So this session we will see that what is difficulty in swallowing and what are the management for difficulty in swallowing which we can do from our side. Welcome back to Ali's EduTech. I'm a registered nurse and a healthcare educator dedicated to empowering you with detailed health knowledge. Don't forget to like, subscribe and hit the bell to stay updated on our latest tips. We can see over here what is dysphagia. Dysphagia, difficulty in swallowing, how this occurs. When there is a damage in brain that occurs in stroke patient that affect the muscles involved in the swallowing. So what will happen in that whenever it affect the muscles for the swallowing, there is swallowing difficulty can occur. This is common in ischemic and hemorrhagic stroke. So mainly brainstem, cerebral cortex or cranial nerves controlling swallowing can affect in stroke patients. So due to that, difficulty in swallowing can occur for the patient. Now, what are the signs and symptoms which occurs when there is dysphagia? How we can understand, how we can identify it? There is coughing or choking while eating and drinking. So this is a sign or we can see in dysphagia patients. There is drooling. Whenever they drink a liquid, there is drooling from one side can occur. Also, the solid food, whatever the patient have, that will be inside, remain inside the mouth only. There is no swallowing occurs due to the muscles are weakened over there. The normal swallowing process is not happening. Also, unexplained weight loss because the patient is not eating anything. So there is a weight loss and a dehydration can occur in such type of patients. Also, there is wet or gurgly voice after swallowing. If they try to swallow it also, there is a wet or gurgly voice can hear from these patients. Then recurrent pneumonia due to aspiration. Here we can see that as I explained already in the normal swallowing process, we have a airway in front and we have esophagus in the back. That is the food pipe or the esophagus. It's called esophagus. So whenever the food enters into the esophagus, it closes the airway over here. But when there is difficulty in swallowing, the muscles are weakened. So there is this closing is not occurs over here. Due to that, there is a chance of food aspiration into the airway. So due to that, there is recurrent pneumonia or aspiration can occur for such type of patients. These all patients, there is frequent throat clearing can be seen. Also, there is difficulty in initiating a swallow because the swallowing reflex is not triggered on time. So these are the signs and symptoms of dysphagia. Now we can see that what are the causes. Usually it occurs whenever there is dysphagia occurring, there is a muscle weakness or paralysis due to the stroke occurs. So due to that, what happens, there is no coordination among the muscles of the mouth, throat and esophagus for chewing or swallowing. That is due to muscle weakness and paralysis. Then there is loss of sensation in such type of patients due to brain damage. In such cases, what is happening, whenever there is a food inside the mouth, the patient will not feel that there is food inside. So reduced ability to feel the food or liquid in the mouth. The next is poor coordination. Because of the muscle weakness, what happens, inability to properly time the swallowing reflexes. So triggering of the swallowing reflex is not occurring on time over here. Then there is cognitive impairment due to brain damage. What is happening, there is it may affect the awareness of the swallowing difficulties. The patient will not feel that patient is having such type of swallowing difficulties. So these are the common causes. We can see some of the management and the treatment for dysphagia. There are some types of exercise which is there to prevent or cure this dysphagia. It helps in appropriate swallowing. So the first one is tongue strengthening exercise. Tell the patient that just press the tongue against the roof of the mouth and hold for 5 seconds, and this can be repeated 10 times. So press the tongue against the roof of the mouth and hold for 5 seconds and repeat it 10 times. Next is tongue side to side. Tell the patient to move the tongue from left to right inside the mouth and hold for 2 seconds. That means from the left the tongue to move to the right side and hold over there for 2 seconds and repeat the same for 10 times. Then the third one is tongue push out. Tell the patient to stick out the tongue as much as the patient can and hold for 5 seconds outside and repeat this for 10 times. So that's called a tongue push out. The next is lip and cheek strengthening exercise. That's first one is pucker and smile. Alternate between puckering the lips. Puckering the lips means like a kissing that lips are taking out. No, so that's called puckering. So puckering the lips and smiling. Pucker the lips like this and then smile. So do it frequently. This is also a strengthening exercise for the lip and cheek. Then the next one is cheek puff. Fill cheek with air and hold for 5 seconds, then release. This can be repeated for 10 times. So these are some of the exercises we can teach to the patient. Then another exercise we can read more about it is laryngeal exercises, shaker exercise, Masako maneuver. So different types of strengthening exercises are there to manage dysphagia. Another management is dietary modifications. Thickened liquid soft foods can offer for the patient to prevent choking. Mostly the liquid type of foods are more prone for aspiration. Then postural adjustment. That's called a chin tuck method. Whenever the patient starts eating, taking the food inside and start chewing, just tilt the head a little bit behind and do the process. Then the last one is swallowing time. Just chin to tuck down. As you can see over here in this video, the patient is still chin is tucking down. Patient start eating. Head is tilt a little behind while eating, while chewing. Then see swallowing time, chin tucking down. So this way the patient can do while eating the food. So that's called a chin tuck method. Another one is alternative nutrition. That means if the patient is having severe dysphagia, nasogastric or PEG tube can be inserted for the patient. Through that, the patient can be fed from the tube, through the tube. Then preventing aspiration pneumonia by good oral hygiene while upright feeding, suctioning, these all can prevent aspiration pneumonia. PEG tube is percutaneous endoscopic gastrostomy can be do, and then the tube can be placed in the abdomen to the stomach. Some additional tips. Always keep in mind, sit upright while eating and drinking. Take a small bites and tips. Avoid talking while eating. Eat slowly and chew thoroughly. Stay upright for 30 to 60 minutes after eating. Here you can see that there is a healthy swallow. While normal swallowing time, what is happening? Here you can see over here, this is the airway and the airway closes over here while eating and the food goes into the esophagus. This is normal swallowing time. Whenever there is dysphagia occurs, weakening of the muscles occurs. So due to that, this closure will not occur over here. Due to that, there is a chance of food entering into the airway to the lungs, and also it half goes to the stomach also. Such situations, aspiration, different types of the complications can occur for the patients. So these are some of the management and treatment for dysphagia. Hope you understood. Thank you.